Dr. Courtney Burns, Doctor of Nursing Practice. Thanks for tuning in to the NP Consult. I hope you enjoy this video over physical activity. I just wanted to jump on here and say I decided to do this video because I do think physical activity is important. And also I did my work for my Doctorate of Nursing Practice in high blood pressure and physical activity. And in my project, I did show a reduction in blood pressure when patients did the addition of 150 minutes a week of moderate intensity activity. So that was great that I had a positive correlation and a decrease in blood pressure. So I hope you enjoyed this video over physical activity. I also did want to mention, don't forget to look at the description of the video and you'll find the consultation notes there. And that's just a timeline of the things that we talk about in the video. And you can always just refer back to that if you want to jump to a certain section in the video. Thanks for tuning in and I hope you enjoy it. It's Dr. Courtney Burns, Doctor of Nursing Practice, and welcome back to the NP Consult. So on today's video, we're going to be talking about physical activity. February is National Heart Awareness Month, and physical activity is one of the most basic things that your patient can do to help with their cardiovascular health. So I just thought talking about physical activity, how much is needed, what's the intensity of activity that's going to be needed, what benefits are we going to get from physical activity, what resources are available for your patients. Those are all things that are talked about in this video, and I just thought it would be important to talk about physical activity. So physical activity is really just the amount of energy that we're going to be expending over the basal rate. So we are going to need to do some activity over our resting basal activities. So, getting patients to be active and just not sedentary is going to be important, but also just getting them to actually get up and get their heart rate going is really what's most important. So telling your patients just, any activity is going to be better than doing no activity. But we do know that the more that we do, the more benefits that we are going to get from that physical activity. And despite all the benefits that we do get from physical activity that we're going to talk about here in a minute, it's really not talked about at most clinical encounters by, most providers, whether that's primary care providers or someplace else. It's just not talked about, which I know we have lots of other things that we're trying to talk about and address with our patients, but physical activity should be something that's addressed and is important. There was a study that came out in October of 2018 in the Journal of American Medical Association, and I will go ahead and give you guys a link to that study. But in that study they did show that people that are physically inactive are going to have the same, if not greater, risk for mortality when compared to patients that do more traditional risk factors for cardiovascular disease like smoking or have diabetes. So really that's pretty important. Patients that are physically inactive are going to have either the same or a higher risk of mortality when it comes to cardiovascular disease than patients that are smoking. So, it's really important to go ahead and talk to our patients about physical activity. It's also really expensive for our country. It's costing our country about $117 billion. It's costing our country about $117 billion a year, just with patients that are being, or people that are being physically inactive. Also, so many people are living with chronic diseases in this country, and physical activity can help reduce those or even prevent those chronic disease. So just another benefit we can get from physical activity. And the Department of Health and Human Services does come out with their physical activity guidelines for Americans, and they first came out with their guidelines in 2008 and then again updated in 2018. And most of the information from this video is going to be coming from the Department of Health and Human Services physical activity guidelines for Americans. But there are a lot of benefits that we're going to be able to get from physical activity, just a reduced, mortality overall, a reduced cardiovascular disease risk. It's going to help reduce our blood pressure, help with our bones, so keep our bones stronger, reduce risk for osteopenia and osteoporosis. Also going to help with our mood, so keeping, us feeling better, so less anxiety and depression. Also going to help with our cognition, so just help us think faster and more clearly. For older adults, that's going to be really helpful, but it's helpful for us all. Also with older adults, less risk of Alzheimer's. So, if we can tell our patients we're more physically active, our brain is just going to work better. We're going to be sleeping better at night. It reduces our risk for cancer. So for sure going to reduce our risk for bladder cancer, lung cancer, endometrial cancer, GI cancers, breast cancer, colon cancer. So really being physically active is going to reduce our risk for cancer, which is important. It's a cardiovascular disease and cancer are both really big reasons and causes for death in this country, cardiovascular disease being number one. So, talking to your patients about physical activity can help reduce those risks, and also just improve our physical function. So older adults are going to just be able to be more functional, less frail, have less falls if they're more physically active. And then pregnant women are also going to get benefits from activity, which we'll talk about here in just a minute. So how much physical activity do we need? So for adults, so that's going to be 18 to 65. Those people are going to need about 75 minutes a week, about 150 minutes. So 150 minutes a week of moderate intensity activity. So it's 150 minutes to 300 minutes a week of moderate intensity activity. And moderate intensity is really just something that's going to get their heart rate up. So that's what we're looking for. We don't need to talk about, metabolic equivalents of task or METs, which is how we're figuring out the intensity of physical activity, but they just need to know for a moderate intensity activity, they're going to need to get their heart rate up. And also, they could have a conversation during this activity. So it doesn't need to be so vigorous that they couldn't carry on a conversation with somebody. That's called the talk test. They just need to be able to get their heart rate up. And 150 minutes a week is the recommendation, 150 to 300, but you could go over 300, but you want to try to be getting at least 150 minutes. And some activities that are moderate intensity would be gardening, bike riding, like a slow bike ride, a brisk walk, dancing, tennis, water aerobics, really any activity that they can think about that they're doing that's going to get that heart rate up, and then preferably spread out throughout the week. So 150 minutes a week spread out, maybe 30 minutes 5 days a week, but really any activity that they're going to be doing is going to be beneficial. So if they can only do 15 minutes at a time, or maybe they can only do 5 minutes at a time, then just encourage them to do whatever they can do, but try to spread that 150 minutes a week, 150 minutes out throughout the week. And then if they're doing more vigorous activity, so this is going to be something that's getting the heart rate up, but also getting the breathing up, so they may not be able to have a conversation during the activity. And it's recommended that we do that about 75 minutes a week, so 75 to 150 minutes a week of vigorous intensity. So that could be, like a jog or run, faster bike ride. There's a lot of activities out there that are going to be more vigorous, where they're going to, not be able to breathe during the activity, or not be able to talk, during the activity. They're going to be able to take more breaths. And then additional benefits are found if we go over the recommended amount, so we can do that, and it's not shown that we could do too much physical activity, but they do want to focus on trying to get the least amount, because only 1 in 5 Americans are getting the recommended amount of physical activity according to the CDC. So and then if we can also add in a couple of days a week of resistance or strength training for our muscles, it's recommended that we do that on top of the 150 minutes a week for the moderate intensity. And then you can tell your patients that really just a single episode, though, of moderate intensity activity is going to give them benefits. So just doing it that day, you're going to have a reduced blood pressure, you're going to feel better, so a better mood, you're going to sleep better that night, so you're going to think better, you can have better cognitive effects that day. So even just a single session of moderate intensity activity is going to give you benefits, but those benefits are going to get better and build up over time. And then, but disease reduction and improved function can really be occurring over days to weeks. So it really doesn't take that long to start to see an improved function. once we start doing physical activity. So the biggest thing is to just really talk to your patients about physical activity. Find a way that you can do that. Either have your nurse or medical assistant ask them about physical activity. If it's in your electronic medical record, you can do that, or you can have them give out a handout. But something that kind of addresses their physical activity, you can just give them a handout. There's resources available online, and I will give you guys the site to be able to go and find some of those resources, because we just want to be able to talk to our patients about that, find the time to do it, find out what barriers that they're having for physical activity. So, you may find out that if they're an older adult, they may be afraid that if they start doing physical activity that they're going to, have a heart attack or have a cardiovascular event or, have an injury. And just know that there are some risk of doing physical activity, but the risk of any, sudden cardiovascular event or, really risk of injuring ourselves majorly is really low whenever we're doing physical activity or starting that program. So just reassure them that the risk of injury is very low, and the benefit of getting the physical activity is going to outweigh that risk. Find out if they feel like maybe they just don't have enough time. Just try to find ways that they can work that physical activity into their schedule. So even if it's just 5 minutes at a time or 15 minutes at a time, or finding that activity that they can do with their, maybe with their children after work, like going on a walk, or maybe even if they're watching TV in the evening time, if they have a favorite program they like to watch with their kids or by themselves, just to be able to maybe get up during those commercial activities and do some activity that's going to get their heart rate up. So just trying to not be sedentary, but also just trying to find time in their daily lives to get in that physical activity and to increase their heart rate. And they may say, I don't like physical activity. You can definitely find something that they do like that they can do for physical activity. And there's a campaign out there with the CDC, Move Your Way, and it talks about different barriers and how you can talk to your patients about that. So just have something ready to go ahead and talk to your patients when they say, but this, or but this. You can just have something ready to kind of go ahead and address those barriers. And the biggest thing is, again, just to kind of to start low and go slow in that activity. So if they haven't really been engaging in activity, you just want to find a way to have them start that activity slow or low and just go slow. So even if it's just starting with 5 minutes at a time, multiple times throughout the day, or multiple times a week, and then increasing that to 10 minutes at a time, and then to 15 minutes at a time. But eventually their stamina will get up and they will be able to do more. So just trying to encourage them to start somewhere. So just start low and go slow. For older adults, they're going to need the same amount of physical activity as the other, 18 to 64. So basically just, the 150 minutes a week, but also just trying to work through their physical or mental capabilities that they may have. Again, having them go slow or go low and start slow is going to be important. But they're really going to get a lot of benefits from them. Just tell them that they're going to, having better cognitive abilities, less risk of dementia and Alzheimer's. They're going to have less likely to fall, feel stronger, so going to feel less frail, and help them with their chronic illnesses, since, a lot of older adults are living with chronic illnesses. So if they do this physical activity, it should help lower their risk for these diseases, but also help manage them. And I think the biggest thing is just to figure out what barriers they're having, and just say that you're going to get benefits from this activity. It's going to outweigh any risk, and we should just go ahead and start somewhere. And then just finding out again where they're at with their activity. But they are going to see an increase strength in really about 3 to 4 months of doing that moderate intensity activity, multiple times a week. They're going to start to see that increase in their strength in about 3 to 4 months. So for children are going to need, they're going to have different recommendations, and they're going to have, different ways to find, or find different ways to do their activity. So for toddlers and preschool children, so 3 to 5 years or less, they're going to need about 3 hours a day of structured play that is going to be physical activity. So just trying to not have them be so sedentary or reduce screen time, but trying to get that 3 hours a day. When they get to school age and older, so age 6 to 17, they are going to need 1 hour a day of moderate intensity activity. So they really need more activity than we do. So just trying to encourage them to find those activities, find out whatever they like, because this is a perfect time for them to build, healthy habits for the future and find out what they like to do for physical activity now, and then also just maybe encouraging them to do it with their parents so the whole family can be physically active. And they're really just going to have a better chance of being that healthy adult if they are being more physically active when they are younger. And we know now that, with kids, there's increased obesity, increased high cholesterol, increased diabetes. So just getting them to be physically active and continuing that through adulthood is important. And for pregnant women, they're going to need the same amount of activity, but if they have not been active before, then again, they're just going to need to start low and go slow. But if they, have been physically active before pregnancy, they can just start at the same amount of activity that they were doing before, and just continue that activity during pregnancy. But they can start and also increase that activity. They just want to kind of start low, go slow, be under the a supervision of somebody that can also be monitoring the baby and monitoring the baby's growth, monitoring, mom throughout the pregnancy. They also want to find activities to do after the first trimester where they're not laying flat on their back. So again, just want to find activities past that first trimester where they're not laying flat. And they're going to get a lot of benefits from physical activity. It's going to help them maintain their weight, help them maintain their stamina or get more stamina. They're going to be able, sleep better, have a better mood during pregnancy, less risk of gestational diabetes and high blood pressure. So just encourage women that are pregnant to also be physically active. And so really just talking to your patients about physical activity is important. Finding out their activity level that they're at now, finding out if they're at the less than the recommended amount, if they're not doing any activity, if they're at the recommended amount, could we increase that to get more benefits? So just finding out what activity level your patient is at now, finding ways to incorporate talking about physical activity with your patients. So whether that's, with a handout or discussing it when you're discussing their blood pressure, but really we want to try to talk about physical activity at most encounters if we can. And then just knowing some community resources that are out there and available for your patients. So some different things that might be available in your community for physical activity, or even, free classes, just different ways that you can get them physically active. So that was our video today about physical activity. Again, I will go ahead and put some resources and references at the end of the video for you guys. So you have that, and most of the information in this video did come from the Department of Health and Human Services, the Physical Activity Guidelines for Americans.